What's going on, guys? Firing it off a little later today. Just want to mix it up on y'all. You already know. Just kidding. Anyways, good evening, everyone, and welcome to another enlightening episode of Know Your Pharmacist, where we bridge the gap between healthcare and knowledge and community needs. I'm Dr. Joaquin Acosta, your host and passionate force behind Pharmtrue. Tonight, we're diving deep into topics that resonate with each of us on a personal and societal level. In today's show, we're exploring the vital role of community health centers like the Harvard Street NHC, stepping up to fill the void left by pharmacy closures. It's more than just news, it's about the pulse of our communities and how we respond to change with resilience and innovation. We'll also delve into Elektra Health's groundbreaking approach to menopause care. This is about shattering stigmas and embracing a holistic journey towards health. As a healthcare professional and advocate, I'm thrilled to shed light on these progressive strides in women's healthcare. And for all our wellness enthusiasts, we're discussing the health benefits of magnesium glycinate and introducing Texas's first CBG, that's right, you heard me, based cannabis beverage. This segment is a testament to how natural solutions can be transformative in our daily health routines. In our community spotlight, we pay tribute to Officer Jonah Hernandez, a symbol of dedication and bravery. His legacy is a reminder of the profound impact of community service and true upstanding citizenship. We really grieve losing Officer Hernandez, and today his funeral was held virtually. We'll show a little bit about that. Rounding up, we'll scrutinize the evolving landscape of men's health clinics, navigating the space between innovation and tradition. As we journey through these topics, I invite you to engage, question, and grow with us. Your perspectives enrich our discussions, bringing diverse insights to the forefront. So buckle up for a ride filled with education, inspiration, and groundbreaking healthcare insights. Let's transform the way we think about health together. Remember, you're not just viewers, you're an integral part of this transformative journey, so let's get started. All right. Pharmacist Frontline segment. Anybody heard of these Harvard Street Health before? Showing you guys right now. Interesting little community gap closer here, and we'll take a little bit of a look at this. So below, it's showing a patient at the Harvard Street Neighborhood Health Center filling a prescription with a certified pharmacy technician at the center's pharmacy on Blue Hill Avenue. Dorchester's network of community health centers can help fill the void left by several chain pharmacy stores that have closed in recent months. Harvard Street Neighborhood Health Center, NHC, on Blue Hill Avenue is encouraging residents who have been impacted by recent pharmacy closures to take advantage of their services. U.S. Senator Ed Markey, Senator Elizabeth Warren, and U.S. Rep. Ayanna Pressley, Mayor Wu had all lobbied Walgreens CEO Tim Wentworth in recent months to reconsider the closing of the last Walgreens in Roxbury, located in 416 Warren Street, but the location was permanently shuttered on January 31st. At the Urban League of Eastern Massachusetts annual meeting on the same day, Wu said that the city was exploring the possibility that a locally owned pharmacy could move into the same location, or that they could potentially form a partnership with Lyft to provide free or reduced fare to transport residents to other nearby pharmacies. January 31st shutdown was the fourth by Walgreens in the neighborhoods of Boston in just over a year. Critics say it signals a shift away from neighborhoods of color to communities that are predominantly white. In the meantime, community health centers in the vicinity can be a viable and convenient replacement for those who need to fill prescriptions. Harvard Street is one of the several health centers that have their own pharmacies inside their buildings. Others include Codman Square, Whittier Street, Uplands Corner, Neponset Health, Peter Gibson, and Dot House Health. Jessica Rosa, director of operations at Harvard Street NHC, said staff have been proactively reaching out to patients in their system who one time filled their prescriptions at St. Warren Street Walgreens. Many of them have been very upset because they've been using Walgreens for such a long time, and it could have been a few doors or a couple of streets over for them, so it was very convenient. On the other hand, the pharmacy at HSNHC is located within the same building as all the other services, such as family med, behavioral health, eye care, dental care, and more. The patient is there for appointment. They just walk upstairs, and once they're done with their visit, they walk downstairs and grab their meds on the way out, which is the caveat Harvard's trying to fill and close that void when Walgreens is ditching out, and colleges are having to step in and put pharmacies in locations right? How soon could this perhaps be a thing where state colleges of pharmacy or privately funded educational institutions that are partnering with healthcare institutions start filling some of these community voids with things like pharmacies? It's kind of just really frustrating to see that happen in certain ways, just because, again, locally owned community independent pharmacies that are being chased out by the very people who don't want to serve those communities, Walgreens, CVS, all of a sudden have such a really hard time operating. And so local pharmacies having a hard time operating, Walgreens and CVS is the area is not worth their time. Educational schools and institutions like Harvard are trying to go and partner with their, privately funded institution and healthcare systems to be able to target some of these pockets and these predominantly colored communities, underserved communities. And what is that going to mean? Is the UNM College of Pharmacy going to pony up pharmacy, put in rural, places where they're closing down pharmacies in the state? Doubt it, right? And this is not going to be able to happen everywhere in the world. So, it's cool to see, but I don't think this is the answer to closing the pharmacy gaps that are happening right now. I think the answer is local hometown community pharmacies and rising back, the resurrection of that. There is the winner. Operators, yes, as much as it depends on you as a business owner to be able to succeed, the environment out there to compete is as bloodthirsty and as very, very difficult to compete as it's ever been right now. So, that's the industry as it is. This is what Harvard's doing about it right now. And we'll move on to Tech Talk. So anybody who's heard about this, pretty interesting. Elektra Health, menopause expertise for the 21st century woman. I'm no menopause expert by any means. To help answer some hormonal questions, we really take some time to think about it. But a really pretty cool idea here, specialized platform, first of its kind with telemedicine care, evidence-based education, one-on-one support in a private community. So Elektra Health, talking about specifically menopause care, clinical telemedicine care with Elektra's board-certified providers, is now available and covered by select insurance as well. Looking at this, pretty cool service, guys. Let's smash menopause together. 50 million women are currently navigating menopause in the United States. Well, this transition for universal female experience is shrouded in stigma, shame, and secrecy. It's affecting our personal and professional lives. It's time to change the narrative because we deserve better. So, holistic menopause journey starting here, right? Care via telemedicine with a board-certified clinician, prescriptions, labs, and more. Education across evidence-based readings and recs on menopause symptoms, sleep, sex, hot flashes, and more. Support, get one-on-one with your Elektra guide to build questions and a personalized wellness plan. Community, join virtual events with menopause experts, participate in discussions, and get inspired. Pretty cool, right? Even for organizations, 1 in 5 women consider leaving their job due to menopause. Menopause-related productivity losses costing companies $810 billion a year. Joining a community of leading organizations supporting women in the workplace at every stage of life. So pretty interesting, right? Can have a lot of real-time support there. And looking at the stories, I think menopause is a portal from one iteration of yourself to the next. Embrace it, all of it, the good and not so good. It's part of life. It means that you're still here living and experiencing what life brings you. Listen to Bond's story. So, talking here about Siobhan McKinley, the founder of Organics Farm to Skin, Connecticut's premier beauty store that provides organic facials as well as curated selections to over 20 natural, organic, and highly reviewed skincare cosmetic brands. Tongue twister. Anyways, where are you in your hormonal health journey? Perimenopause. What's the one word or phrase that comes to mind when you think about it? Uncomfortable. Most women I hear who talk about menopause complain about it. Feel that menopause is the second phase of a woman's life in the sense that she can take this time to focus on herself, her health, her spirits, her passions, her dreams, and her goals. Which symptoms have you experienced? I've been quite lucky in perimenopause as I've experienced only a few symptoms on occasion, such as night sweats, sleep disruptions. My mother did not experience a difficult menopause. If genetics has anything to do with this, so I hope it's been passed down to me. We know menopause can be challenging, but it can also be funny, enlightening, liberating, energizing, and more. Do you have an anecdote of reflection that shows another side of menopause besides what we're conditioned to fear as women? I feel that menopause is another second phase in a woman's life in the sense that she can take a time to focus on herself, her health, her spirit, her passions, her dreams, and her goals. A lot of things that are all put on hold for women because they are busy working, having children, and raising them. Beautiful time period to focus on children, but as children grow up and become young adults, it gives us more time to refocus on ourselves. And it's an exciting time in a woman's life with so many advantages and opportunities. So, looking at this, what routine to help Siobhan here throughout her hormonal journey, she strives to live a balanced life. Eat as healthy as possible, but not deprive herself of things you want to enjoy and indulge in from time to time. Not believing in being so strict as long as you can do things in moderation, drinking warm lemon water each morning and eating a lot of vegetables throughout the day. Eating a healthy breakfast of oatmeal, fruit, and flaxseed throughout the day. Looking at it, embracing all of it, the good and not so good. The part of life that means you're still here living and experiencing what life brings you. Were there any treatments that help? Taking a new supplement, Seor, which is selling at organic for skin health and nails. Looking at all these things, being able to have that support though and smash the taboo, right, of menopause and have that clinical provider there talking to you, telehealth, specialized there for you. I think this is great, especially when maybe it gets discussed in a regular doctor's appointment, maybe not to the extent that it could be discussed, and maybe some doctors are quite thorough about it, and not everyone might be, right? So I'm sure many different people can explain their own experiences, and so personalized telehealth not only kind of feels probably a little more private and great, it's not a bad idea. So again, connecting things here in our tech talk, and I like to see it, love to love it. All right, let's move on to our enlightenment hour, talking about the health benefits of magnesium glycinate. One of the best, guys. Anybody who's not taking magnesium magox, magnesium glycinate, highly recommend it. It's a good supplement, men and women. We'll talk a little bit about it, right? Magnesium, mineral found in the bones such as beans, seeds, and vegetables. It's necessary for blood sugar control, nerve function, and regulation of the body's stress response, blood pressure maintenance, and many other essential processes. Though it is possible to meet your magnesium needs through diet alone, with a balanced diet, some people require supplemental magnesium to meet their daily needs and maintain optimal magnesium levels. There's many forms of magnesium used in dietary supplements, including magnesium glycinate. Magnesium glycinate is a highly bioavailable, meaning that a large portion is able to enter your bloodstream and have effect on your body in the form of magnesium that can help your health in several ways. Here's everything you need to know about it. So it could promote healthy blood sugar and blood pressure levels. Low levels of magnesium can negatively impact your body's ability to maintain healthy blood pressure and blood sugar, which could negatively impact overall health. Studies show that taking additional magnesium through dietary supplements may benefit those with high blood sugar and high blood pressure, including people with diabetes. People with high blood sugar levels, such as those with diabetes, are likely to develop low magnesium due to several factors, including losing magnesium through frequent urination and through consuming certain medications. Low magnesium levels are especially common in people with uncontrolled diabetes. A 2021 study that included 300 people with diabetes found that people with uncontrolled diabetes had significantly lower magnesium levels compared to people with good glycemic control. The study found that 65.8% of the study participants with hemoglobin A1C exceeding 7% had low magnesium levels compared to 50.8% in people with hemoglobin A1Cs under 7%. Hemoglobin A1C is a long-term marker of blood sugar control. Fortunately, taking magnesium supplements such as magnesium glycinate can help improve blood sugar regulation and magnesium status in people with elevated blood sugar. In 2021, review of 25 studies, it was found that magnesium supplements significantly reduced fasting blood sugar levels and improved insulin sensitivity in people with diabetes and in those at high risk for diabetes, including those with prediabetes, compared to placebo treatments. Who am I talking to? Doña County, right? We are talking about magnesium. It's a great mineral to be putting in there, guys. We are 14%, type 2 diabetic, pretty much completely reversible based on, most providers' opinions. I'm sure you're going to find some niches there. But again, pre-diabetes, I think it's like 58% of people don't even know they have pre-diabetes, right? So again, living in those times, can you perhaps try to buffer your chances? Highly recommend magnesium glycinate. In addition to improving blood sugar control, magnesium supplements, including magnesium glycinate supplements, have been shown to be effective in reducing high blood pressure levels, which is common in people with diabetes. Maintaining optimal magnesium status is essential for healthy blood pressure, as magnesium promotes the release of nitric oxide, a signaling molecule that helps relax blood vessels and maintain blood pressure. 2022, a study that analyzed findings from 24 studies found that people with diabetes who took magnesium supplements had significant reductions in fasting blood sugar, hemoglobin A1C, systolic blood pressure, and diastolic blood pressure. Very, very, very cool, right, guys? So, other things, benefits, talking about things, sounds like it is a mere drug. It's not what I'm trying to give off. I'm trying to give off a highly favored supplement, omega-3s, but magnesium, highly and often overlooked, which can just cause a lot of other problems. Really, really, really. May reduce stress and improve anxiety and depressive symptoms. Magnesium plays an important role in your body's stress response, and having low magnesium levels may trigger or worsen stress and anxiety symptoms. Studies have been shown that taking magnesium supplements such as magnesium glycinate may help reduce symptoms of anxiety and help regulate stress. Several studies have shown that magnesium supplements may help reduce stress levels in people with certain health conditions such as fibromyalgia, as well as decrease stress related to diseases. Findings from a 2017 review of 18 studies suggested that magnesium supplements could have a beneficial effect on subjective anxiety symptoms. However, researchers fully noted that the more high-quality studies are needed to fully understand how magnesium supplements, such as magnesium glycinate supplements, may benefit those with anxiety. Magnesium supplements also may help reduce depressive symptoms in some people. 2022 study that included 60 people with major depressive disorders found that those who took 250 milligrams of magnesium along with an SSRI medication daily for 6 weeks reported reductions in depressive symptoms starting at the 4th week of treatment compared to participants receiving a placebo along with the SSRI. Additionally, in findings from other older studies suggest that doses of magnesium glycinate ranging from 125 milligrams to 300 milligrams multiple times per day can rapidly improve symptoms in people with depression. However, more research is needed. It may improve sleep. Guys, taking food, ideally probably going to be preferred. It might set in your stomach a little odd. Magnesium glycinate, perfectly available. Can be anywhere from 100 to 200 milligrams a dose. Getting Magox 400, still highly recommended. Magox is great. Brand name, depends on where you're shopping it from, but health benefits to be realized, absolutely there. If you're an athlete, if you're a regular drinker, if you just want to be a top of your own game and homeostasis, that's my pharmacist advice, not Joe Rogan, a pharmacist. Don't forget that. Anyways, let's talk about our Herbal Wellness Corner. Texas's first CBG-based cannabis beverage hitting the market. What does that mean, and what does it literally imply for the industry, guys? I think it's just interesting to kind of see what's happening in terms of Texas, what's happening in terms of the cannabis beverage market. Brought to you in our Herbal Wellness Corner by Horse Cannabis Company. We're looking at cannabis beverages. Very interesting because you see some of the non-alcoholic beverages starting to, take their own trend right now in terms of mainstream, and where alcohol a little bit starts to dip beer sales and things like that. What is going to change? Is cannabis going to have some of that market share? Is it all going to coffee? Is it all going to flavored seltzer water, right? We don't know, but we do know alcohol sales have, not necessarily been ramping up the same way that they have. And I don't have the numbers right there on the alcohol sales data, but we are literally discussing the fact that, again, cannabis drinks are going to be a big hit. People are going to be using cannabis drinks to party, to have a good time, to relax. So many different reasons why they actually might be taking a cannabis beverage. Texas rolling out their cannabis beverage on the market, pretty awesome, right? So here's, extra read all about it. Texas Original, the state's largest medical cannabis provider, has launched a medical cannabis beverage called Elevate. This is why it matters. The new drink, the state's first legal CBG-based cannabis beverage, was created to help patients manage conditions like anxiety, inflammation, pain, and depression. And the company says it's only available to patients of the state's compassionate use program. How it works: each 1 ounce bottle of Elevate contains equal parts of THC, the substance primarily responsible for cannabis' effect on mental state, and CBG, a naturally occurring cannabinoid without psychoactive properties. It also contains ginger and turmeric, both of which are established anti-inflammatories. Product sells for $12 a bottle. In states with less stringent cannabis laws, the veritable hippie hollow of Oklahoma cannabis drinks have been available to medical cannabis patients for years, of course. But, though it's low profile, Texas does have this small medical cannabis program, and last year lawmakers looked at the possibility of expanding the list of eligible conditions, but the efforts failed. Yes, but Texans who don't qualify for the medical cannabis program can still purchase products with very low levels of THC. That's where the whole Delta 8, and everything starts to get really messy in the state of Texas, and people, in my humble opinion, get hurt in a unregulated industry, right? You start getting synthetic cannabinoids out there on the market because they're legal to buy, right? And again, you don't entirely have any idea how that works, because you have to cut corners to make that sort of thing happen in a weirdly regulated market. So again, always be sure of who you're sourcing from. But, where once Texas realizes everything can be bigger and better in Texas, they are going to ride, right? And maybe, just maybe it's going to hit a little differently there. And this is one of those things there, I'm sure Texas would have a little bit of a different opinion if they could be leading the industry in certain things. They're having a good, position, even as a state, to really do some things, because they know federally they may really have a big influence on that, especially in election year. All postulation, but again, more things to consider. Guys, let's move on to our community spotlight, brought to you by the Big Chicken Farm. I'm going to share the showing on the screen service of Officer Jonah Hernandez. Life tragically taken so soon from us here in our community on Super Bowl Sunday. Big respect to Officer Hernandez. Heart out to his family and everybody affected. Guys, we'll give this a watch, and don't forget to thank those who are out there protecting us and our communities. It's terrible that we have to be reactive to things like this. We are. All right, guys, last thing for the evening, we're talking Men's Health Minute. Study, questions, concerns, men's health clinical services. So when it comes to direct consumer DTC men's health clinics, it's buyer beware, as many offer costly treatments not supported by evidence and lack proper medical oversight, according to an investigative study published online February 1st, last year, 2023, by Urology. Researchers identified 233 direct-to-consumer men's health clinics, and these clinics offer treatments such as testosterone replacement therapy and penile shockwave therapy and platelet-rich plasma (PRP) injections to treat erectile dysfunction. However, the researchers noted that the criteria for using PRT are still under debate, and most of the clinics did not follow standard protocols for testing and diagnosis of low testosterone levels. And the effectiveness of penile shockwave therapy and PRP are still being studied and only be offered in clinical trial settings. What does that mean? Be careful what sort of online services you may contract out. Be careful what sort of providers you use. It's really easy to start targeting out niche services like, men. Are you having a hard time getting it up, right? And in a private ad that's seeing you on your phone, it's really easy to maybe get conned into something, right? Of course, I think that study is a good representation of that. Men's health industry can be just as snitch as the cannabis industry, right? You never know if somebody's out to get you. You never know whatever these things could be, right? And it sucks to say that sometimes and relate our healthcare industry to that. But these are the problems that I seek to fix. And we will roll out with that. Happy Hump Day, Wednesday, February 21st, 2024, and we will see you.